Now let's take a moment to talk about how reauthorizations for current patients are processed within the ACE application. Moving along in our workflow diagram, we come back to our snail. Based upon authorization dates, a therapist will receive a notice, a scrolling alert, and an inbox message that requests that they do a reauthorization questionnaire. In that questionnaire, the clinician will answer questions about the current level of goals, goal progress, barriers to progress, etc. Again, it's important to remember that this needs to be thoughtful. If the patient has met goals or discontinued goals, then a new plan of care would need to be done before the authorization questionnaire is completed. When that authorization questionnaire is signed, a message is sent to the administrative group. The administrative group user needs to accept that message. The message will then move to the user's inbox. The administrative user will then open the patient record using the attachment button. So let's take a look and see how that looks in practice. From the administrative work group, the user accepts all messages for authorization questionnaires, reauthorization questionnaires, and new plans of care. The actions of accepting the messages from the work group will automatically move the messages into the user's private inbox. Then the user will open a message regarding the completed reauthorization questionnaire and use the patient link to navigate directly to the authorization tab of the patient record. Next, the user will click on the button for the authorization request form. This form may take some time to load since it's pulling data from so many different areas of the program. Please be patient. Next, the user should copy and paste the data from the authorization request form into the ChoicePA website. When the user has completed the request on the ChoicePA website, the user should enter the requested date into the row for new Medicaid authorization. To avoid data entry mistakes, which can happen easily, use the Date Picker Calendar feature when inputting the date. Once authorization is received for the patient, enter the received date, begins date, ends date, and visits approved into the new Medicaid authorization row. Next, click the Send Alert button to notify the treating therapist of the approved authorization. Once the alert is sent, the user will receive confirmation via a pop-up. Next, the user should index the authorization PDF document into the patient's EMR. The user may do this by clicking on the EMR tab of the patient record and clicking the Index New EMR button. The user will then use the Browse button to locate the authorization approval document. The user should enter the document type as Authorization, enter the appropriate document date, begin date, end date, and any appropriate comments. Finally, the user should click the Save EMR button to add the document to the patient's EMR. Finally, the user may delete the original inbox message regarding the reauthorization questionnaire. This concludes the instructions related to reauthorizations in the administrative portal of ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written Administrative ACE manual for detailed instructions and screenshots related to specific features and tasks.